Hi, this is Jay Arthur. On page 95 of the Healthcare Data Guide, you'll find some data for doing a P-chart. Now, this is very simple with the QIMacros. So this is returns to surgeries. So number of surgeries and people who have to come back. We'd like that to be 0, but that's not what it is. All right, so if you select returns and surgeries, you could come down under our pull-down menu and choose P-chart, or you can go to Control Chart Wizard. And the Control Chart Wizard will ask, can there be more than one defect per unit? Well, if you think about returns to surgeries, it's possible, but theoretically the answer should be no. If you say no, it'll give you a P-chart. That's the difference between the P and the U chart, is the P-chart, there can only be one defect per patient, for example. One cesarean per delivery, something like that. However, if you have something like patient falls, there could be more patient falls. So here's our control chart, our P chart, which shows that we have varying control limits based on the number of surgeries. And so far, so good. There's no red points, so it's a stable process, and we can count on 0.02 fraction defective. Now, if you want to turn this into a percentage, just click on the y-axis. We're going to right-click here, and then we could actually format that axis. And we could come in and say we want to use a number. In this case, we use a percentage, but maybe we don't want to use a big percentage. But what it'll show us here is we got about a 2% return to surgery rate. So if you just want to change that to a percentage, that's pretty easy to do. You could also copy this data into a P-chart template. Go to the QIMacros pull down, choose P-chart template. Here's our P-chart template. You go back and get our data, copy that, and paste that into our P-chart. Then we can click on Filter, and that'll give us our P-chart of returns to surgeries. And that's how easy it can be to do a P-chart in the Healthcare Data Guide using the QIMacros.